Empowering dementia care through a person-centered approach. Empowering dementia care through a person-centered approach emphasizes holistic and individualized care. It highlights the significance of tailoring care to enhance quality of life and patient satisfaction while acknowledging the challenges in implementation. In the realm of dementia care, the emphasis on a person-centered approach has become a cornerstone for effective treatment and support. This model transcends the traditional focus on medical interventions and research, acknowledging the multifaceted needs of individuals living with dementia. Person-centered care, a concept rooted in the principles of patient-centered care theory, prioritizes the unique preferences, values, and needs of the individual, shaping care delivery around these elements. Understanding person-centered care. To define person-centered care is to recognize the individuality of each dementia patient. This approach, grounded in the person-centered care theory, views each person as a unique individual with their own life story, preferences, and abilities. By adopting a person-centered framework, healthcare providers can tailor their services to align with the patient's needs and preferences, thereby enhancing the quality of care. The importance of a holistic approach. In person-centered healthcare, the focus is not solely on medications or treatments, but encompasses a holistic view of the patient's well-being. This includes nutritional support, understanding and catering to the dietary needs of dementia patients; psychological and emotional support, offering counseling and mental health services to address the psychological impact of dementia; spiritual care, recognizing and respecting the spiritual needs and beliefs of patients; community resources and engagement, connecting patients and their families with community resources for additional support; financial guidance, assisting families in navigating the financial aspects of dementia care; addressing accessibility and quality. A critical aspect of person-centered services is addressing the accessibility of dementia care, especially in rural areas where resources may be limited. Healthcare providers must develop collaborative models designed to serve the diverse needs of these communities, ensuring that families receive the best possible care regardless of their location. Leveraging technology. Modern technology, particularly in the form of interconnected computer systems, offers immense potential in enhancing dementia care. These technologies can be utilized to ensure continuous improvement in the quality of care, making the healthcare delivery system more efficient and responsive to patient needs. The role of consumers in shaping care. As healthcare consumers, there is power in demanding changes in the way dementia care is delivered. Advocating for a person-centered approach and supporting caregivers are crucial steps in ensuring that dementia patients receive comprehensive and compassionate care. Developing a person-centered care profile. Creating a person-centered care profile in the early stages of dementia is essential. This profile should include daily routines, establishing consistent daily routines while allowing for flexibility; stable care partners, minimizing changes in caregivers to promote a sense of security; scheduled care times, regularizing times for meals, care, medication, and social activities; encouraging independence, promoting self-reliance in daily activities for as long as possible; implementing a dementia home care plan. Developing a home care plan based on the person-centered profile is vital. This plan should be comprehensive, including both short-term and long-term objectives, and should be adaptable as the patient's needs evolve. Person-centered care is a holistic approach to dementia care that focuses on the individual needs and preferences of the patient. This approach has gained significant attention and support in the healthcare community, but like any approach, it has its advantages and disadvantages. Pros of person-centered care in dementia. Enhanced quality of life. By focusing on the individual's preferences, history, and personality, person-centered care helps maintain the dignity and self-esteem of people with dementia, leading to a better quality of life. Improved patient satisfaction. Patients feel more respected and valued when their personal preferences and backgrounds are considered in their care plan, leading to higher satisfaction levels. Better engagement. This approach encourages the involvement of patients in their own care planning and decision-making, which can enhance their engagement and cooperation. Reduction in behavioral problems. Tailoring care to individual needs and preferences can reduce agitation and other behavioral issues common in dementia patients. Family involvement. Person-centered care often involves family members in the care process, leading to better understanding and support for the patient's needs. Holistic approach. It considers all aspects of the individual's life, including psychological, social, and spiritual needs, not just their medical requirements. Flexibility and adaptability. The approach is adaptable to the progression of dementia, allowing for adjustments in care as the patient's condition changes. Cons of person-centered care in dementia. Resource-intensive. Implementing a person-centered approach can require more staff time and training, as well as potentially higher costs, to provide personalized care. Inconsistency in care. There can be variability in the quality of care depending on the caregiver's understanding and implementation of the person-centered approach. Challenges in severe dementia cases. As dementia progresses, it can become more difficult to discern individual preferences and needs, making the approach more challenging to implement effectively. Dependence on trained staff. The effectiveness of person-centered care heavily relies on the training and empathy of caregivers, which can vary widely. Potential for overlooking medical needs. While focusing on personal preferences and comfort, there's a risk of inadvertently neglecting medical aspects of care. Limited applicability in certain settings. In settings with high patient-to-staff ratios, such as some nursing homes or hospitals, consistently providing person-centered care can be challenging. Potential for family conflict. Involving family members in care decisions can sometimes lead to conflicts, especially if family members have different views about the best care approach. Person-centered care in dementia offers a more humane and individualized approach to care, emphasizing the importance of treating patients with dignity and respect. However, the implementation of this approach requires adequate resources, training, and a supportive environment to overcome its challenges and maximize its benefits. The significance of encouraging independence. Encouraging independence in the early stages of dementia is crucial. This involves being attentive to signs of frustration or confusion and providing assistance as needed, while still allowing the individual to do as much as they can independently. Embracing a people-centered care approach in dementia treatment is not just beneficial, it's a necessity. This approach requires healthcare providers to view each patient as a whole person, not just a diagnosis. By focusing on person-centered services and incorporating the person-centered care model into every aspect of care, we can ensure that individuals with dementia receive the compassionate, respectful, and effective care they deserve. Pointers to communicating with a person with dementia. Some important pointers to bear in mind when caring for the person with dementia include being polite and avoiding talking down to the person. When talking to the person, use various means such as talking, pointing, sign language, or whatever means that will get what you are saying across. If the person is in the latter stages of the disease and has difficulty communicating, try to help by filling in the blanks for them. Avoid being critical or harsh, even when the person is being difficult. As much as possible, include the person in conversations. Give lots of encouragement and get the person to do things for themselves and offer help only where it is necessary. When helping the person, take time to explain what you are doing and why you are doing it. Research has shown that person-centered dementia care, where the caregiver sees the person rather than the condition, improves the quality of care. Proper care of the person with dementia means changing previous views on the abilities of the person with the condition. A diagnosis of dementia does not mean that the person is no longer able to make decisions and take responsibility for their life. Finally, the caregiver should think about how they would feel if they were coping with the illness. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.